Hello Shady lovers, welcome to another episode on Medication Monday. On today's episode, we'll be continuing our kidney failure disease. Now we are at the management stage where we are dealing with the medications that is used in management of kidney failure. Kidney failure in itself is multifactorial. What I mean by this is that it's got to do with you controlling the blood pressure, blood sugar, metabolic acidosis, the systems become acidic. It's also got to do with high levels of phosphate and low levels of calcium. It's got to do with low levels of hemoglobin, that's anemia. So we'll be tackling each and every one of them with regards to the treatment. So first on the list is got to do with blood pressure control. At this point where the kidneys are failing, where your EGFR is less than 15%, what happens in here is we are not aiming at curing the condition, but we are aiming at slowing down the progression of the kidneys deterioration status, sustaining life and preparing patient for kidney replacement or renal replacement. So when this happens with regards to the blood control, blood pressure, we are aiming at 130, that's the systolic, the upper figure, and the lower figure is the upper figure is 130, the lower figure is 80. This is the how do you call it, the target that we'll be looking at. But in kidney failure, it's quite hard to achieve this, but it's still achievable for some in some cases. So the first on the list with regards to the medication is got to do with what we know as ARBs and ACE inhibitors. So I'm going to break them down. With regards to the ACE inhibitors, that's the angiotensin converting enzyme inhibitors. Example is got to do with lisinopril, ramipro, captopril. These are the ACE inhibitors. And what this class of medication does is they prevent the conversion of angiotensin 1 to angiotensin 2. Angiotensin 2 is the stubborn chemical that causes the disruption in kidney failure, where it causes constriction of the blood vessels and accumulation of fluid. So when this one is blocked, it helps reduce this situation. However, with this kind of blood pressure medication, they've got side effects of dry cough. So when it's not tolerated in this and some patient, then we switch them on to the alternative that considers the ARBs, that's the losartan, valsartan. I'm going to continue this in the next video. Thank you, Shady lovers.